listening to Alabama the Beautiful with cosmetic surgeon Dr. James Koehler and Kirstin Jarvis.
Hey, Dr. Koehler.
Kirstin.
What's up?
Not much.
Do you know what we're talking about today?
No, what are we talking about?
We are going to get into the nitty-gritty of the two most popular facelift techniques.
Okay.
The deep plane facelift and the SMAS facelift.
Sure. All right.
All right.
What you want to know?
Can you give us some history of facelift techniques?
And, the techniques for facelift has really evolved because the earliest facelifts were skin only. Like people would just undermine the skin and then pull the skin tight. And yeah, well, and that's where, sometimes people kind of got these weird appearances because the skin was like pulled tight. And a lot of times, I'll have people say, well, I really don't like these lines here. Well, if somebody pulls that skin really tight and gets rid of your nasolabial folds, I mean, it doesn't look proper. It looks like you were in a wind tunnel, So there's certain things that we do. Yes, we want you to look as youthful as possible, but the other key to a facelift is making you look as natural as possible. With a SMAS technique and with a deep plane, we're elevating the skin. That's the first thing that happens is the skin is lifted up. But then it's what you do to that next layer underneath the skin that's different. And with the SMAS techniques, you either take a little strip of that tissue out. Okay, so that layer is called the SMAS, the superficial musculoapneurotic systems, big long word, but it's the musculofascial layer. And so some people will take a little strip of that out, and then it gets repositioned with sutures to a higher location. Whereas the deep plane facelift, you get below or into that layer and you elevate that along with the skin attached to it all the way pretty much to the nasolabial fold here. And then that entire layer is lifted up and secured with suture. So the main difference is with the SMAS technique, you're just taking a strip out and you're not really continuing that dissection further forward and releasing all the ligaments that sort of help retain the face. Whereas a deep plane facelift, you have to release all of those ligaments to get everything free, and then you reposition the tissues. And so the big difference is with a SMAS technique, you can actually get very nice results. So let me just start off by saying that I think both techniques in the hands of a good surgeon, you can give good results. People who tend to gravitate to certain procedures for various reasons, whether it's because they get more predictable results or faster recovery or, whatever it is, there's reasons why people will choose a technique one over the other. But the main, I guess, reason that people that do deep plane facelifting really like the deep plane facelift is that when it's done properly, it actually does have a pretty remarkably fast recovery. And because you're releasing all of the ligaments and repositioning everything, when you resecure everything with the sutures, there's really no tension at all on the skin. And that flap, it really isn't under a lot of tension. And so in terms of a longevity of a result, you're relying less on the strength of your suturing technique with a deep plane facelift, whereas with a SMASectomy, you have to really secure everything up with sutures. And yes, it can hold, but also sometimes sutures don't hold as well. And so the thought is that, if you looked at a facelift that you did with a deep plane versus a SMASectomy in 2 years, 5 years, 10 years, perhaps the patient that had the deep plane facelift in 10 years' time would be looking better than somebody that maybe had like a SMAS technique. That's a lot.
Longevity is better with the deep plane?
Yeah, I think you get a longer lasting result with a deep plane facelift.
So you typically do a deep plane facelift, but are there any modifications that you perform compared to someone else?
Oh, I'm sure, like if you looked at 5 surgeons that do deep plane facelifts, there would be similarities in their techniques, but there also would be lots of little nuances. And it can sometimes be little things like the type of suture a person prefers to use or how they close certain deep layers or structures. Some people like to, like in some of our patients, we shave down the saliva glands in the neck to get a good neck contour and reestablish the jawline. But that's not required. We don't do that routinely with every patient, but in the ones that need it, we do that. And there's some surgeons that would never trim those glands. They just don't feel it's necessary. So like there's lots of little variations, and there's the science of deep plane facelifting, and then there's the art of deep plane facelifting. And the art part is really what distinguishes the maybe one surgeon from another, their view of how to reposition things and I guess their concept of what looks good.
So, are there other variations for individual patients that you might make? Because I know, like you said, you may do the saliva glands for some people and not other people. Are there other things that you may change from one person to the next?
Yeah, I mean, the techniques are really, it has to be tailored for every patient. So like sometimes a consult comes in, they say, well, I would like a facelift, a deep plane facelift even. And that's when, the surgeon evaluates things and you go, okay, well, like maybe you also need a brow lift. We've talked about this, I think, before. It's like sometimes if you don't address the brow and you lift all this up, you can get some bunching of the skin. And so you can eliminate that by doing a brow lift. Or, like with the neck, sometimes I occasionally will have people where I actually don't even need to make the incision up underneath the chin. Whereas I would say probably 90% of my facelifts, we do make that incision under the chin so that we can tighten the muscles in the midline of the neck and also, if need to, get to the gland to shave down the hanging part of the gland. So those variations in the technique of whether or not we need to open the midline, whether we need to combine other surgical procedures like fat grafting or brow lifting or other things to give us the enhancement to the result that we're going for. I mean, that's where, it's not a one size fits all operation. But yeah, I would say that, the technique for the deep plane facelift is definitely like that is my go-to for facelifting. And there may be times where we may, on people who've had maybe multiple prior surgeries, we may have to modify that technique just to be safer and try to protect nerves and whatnot.
Is recovery time, or I guess the difficulty of the recovery, about the same for either one?
Well, years ago, I would have probably said that the SMASectomy was a quicker recovery than doing the deep plane facelift because there's actually less dissection. You do the skin undermining and then you take out that little strip and then you close it and then close skin. But, with the original way that I did deep plane facelifting, I did a lot more skin undermining. So there was a lot more of the skin that was elevated in addition to doing the deeper plane work. And so the dissection was more involved. The results were good, but I would say the recovery was maybe a little bit more than the traditional SMAS facelift. But now, you'll hear people talking about different versions of deep planes where we don't do nearly as much skin undermining. And I would say that, yeah, when I can, I absolutely do that. And in those patients, the recovery is significantly, I think it's much quicker than what we were seeing with some of the SMAS techniques. So,
I was very surprised when I first started working here. Like, just being a person out in the wild, you think a facelift is like, not that it's not invasive, but that a facelift is crazy invasive and it's this huge surgery. But then patients come in here like post op day 7, and you're like, oh my God, you had a facelift a week ago? Like, you would never, not that you would never know, but it just is not as crazy of a recovery as I imagined it to be, I guess, is what I'm trying to say.
yeah, no, I think with a lot of the modifications that we've done, there's certain medications that we use to help decrease bruising and swelling, and just the anesthetic technique, the surgical technique, like things have improved over the years. And although there's many parts of this procedure that haven't changed, in many years, that we're still finding ways to improve recovery for sure. In the deep plane facelift, although on social media it seems like that's the latest, crave, the latest thing everybody's doing. Back in the 80s, the deep plane facelift was also something that was called a composite facelift back then, which is, I won't get into the differences, but it was a deep plane facelift. And, I think the one thing about deep plane facelifting is you definitely want to see somebody who's experienced at doing the deep plane, because the one disadvantage that I would say of doing deep plane facelifting is it definitely puts the nerves in a vulnerable location because of the dissection. Now, if you're experienced doing this, I think it's extremely safe. I don't think it's any more dangerous than a SMASectomy. But again, in the hands of somebody who is familiar with the technique and does this operation, it's not an issue. But I would say for a less experienced surgeon who maybe doesn't really do a lot of deep plane facelifting, I mean, I'd rather have a surgeon do a SMASectomy if that's what they've done their whole careers than try to do a deep plane facelift when that's not what they routinely do.
I want to rewind about 20 seconds. What were you doing in the 80s?
Oh, well, I wasn't doing it in the 80s.
Oh, okay. That's what I was checking.
You weren't even born yet, so I don't even know why you're worried about it. But
I was around for about 5 minutes. Okay. So while every patient is different, is there a ballpark that you may give patients for like how long their results will last? And especially like deep plane versus SMAS, because we've already said that deep plane probably will give you a little longer lasting results.
yeah, nobody's ever done that study. And so really like it's all just subjective opinion. There's not a study that says, oh, the deep plane lasts longer. And that's another thing. Like, that can be a surgeon opinion, but that's not in the medical literature. There's
Mm.
nothing that says that it lasts longer. In fact, there's been some studies on twins that had facelifts where they had one technique and another twin had a different technique. And hey, the bottom line is you can get a good result with all of them. Now,
Mm.
to your first question of like, well, how long does a facelift last, and does it last longer with another technique? That is the impossible question that every surgeon deals with when talking to a patient. And I think there's so many variables. So if you do a facelift on somebody that's aged 50, that is not the same as doing a facelift on somebody that's aged 70. Okay. Even if neither one of them ever had surgery before, the skin elasticity, the health of the tissues can be significantly less. It can be a harder operation at 70 than at 50. And even though the operation can go perfectly the same on both patients, and you follow them a year or two later, I mean, if you have poor skin elasticity, yeah, the longevity of your results is not going to be as good. So I typically tell people, yes, if you do a facelift in your earlier years, let's say 50s, early 60s, you're going to get a longer lasting result than if you chose to do it in your late 60s or early 70s. As we age, it's almost like an acceleration, right? You look at how somebody ages between the ages of 50 and 60 and look at 60 to 70. And there's definitely difference in that 10. They're both 10 years. 10 years went by, but the 10 years from 60 to 70, I think, is you see more significant age changes. So to that point, yeah, we typically tell people hopefully in 10 years time you're still looking better than if you hadn't done the procedure. But yeah, it's a really hard question to answer.
Let's talk about scars.
Okay.
Everybody wants to hear about scars when we're talking about surgery.
Yeah.
So are the scars or the incisions located in different places for deep plane versus SMAS?
So the skin incisions can be done the exact same for both techniques. So they are pretty much the same. So it's going to be sort of in the sideburn, into the crease of the ear, back around the ear, and then into the hairline. And there's definitely some variations, but the skin incision, like you could have the same exact skin incision for both techniques. Okay, so the difference between these two techniques is what's done beneath the skin, not on the skin surface. So you can make the exact same skin incisions for both techniques. And you would never be able to, from the skin incision, say, oh, this person had a deep plane facelift. You couldn't answer that question looking at the scars from a patient. Okay. And in fact, that's sometimes when you're, going back and doing a revision facelift for someone, unless you have that actual operative note, you are really you don't know what was done before. And that can sometimes be, challenge just because of the anatomy has been distorted and whatnot. But anyhow, yeah, so the skin incisions could be the same, but the placement of those incisions is critical to achieving an aesthetic scar. And there are factors that maybe would change the placement of an incision. So, for instance, in a female patient, we a lot of times will put that incision right in the tragus, so like right almost inside of the front part of the ear. And if you did that for a man, and if they have a thick beard, when you lift that skin and reposition it and trim it, now you've got beard hair growing on the tragus of your ear.
Ugh.
And, that's already a challenge as you get older and your hair starts growing in different places you don't really want it to. But now it's really hard because you can't shave your tragus. So now that might not be a problem if a male has a very fair beard or not much beard hair at all. You could possibly do laser hair removal or electrolysis depending on the color of the hair. But sometimes for a male patient, we'll put that incision in front of that part of the ear. And so that's a modification just based off of the gender of the patient. But also that incision may be modified by the anatomy of the way the ear is shaped. And some people who have a little bit deeper, what we call the pretragal, like sulcus, if it's a little deeper, then sometimes we'll put the incision in that deeper part because recreating that when we lift everything and reposition the skin is sometimes hard to do. So these are like little finer points of facelifting surgery. And I guess the point is that as long as your surgeon is recognizing when those variations are going to be needed to get the best possible outcome. It's not one incision fits every person.
Well, is there any research happening right now? I know like techniques evolve and approaches evolve. Is anybody looking at any other technique right now that you may be doing in 10 years?
I mean, I'm sure that there's always people pushing the boundaries when it comes to facelift techniques. I wouldn't say that there's necessarily research. And as I mentioned earlier, there's the science of facelifting, which is, knowing the anatomy and where the nerves are and how to avoid them and all that sort of thing. And then there's the artistic form. And so, I mean, I don't really know that. Yes, there's been changes in facelifting surgery over the past, 20 years, but really there's been nothing. I don't think there's anything that's just like earth shattering. I think it's really just surgeons refining their skills, and it's, finding that doctor has a good foundation in the science, but has the artistic view to give you the result you're looking for.
I love that. Science and art. Okay. Do you have a burning question for Dr. Koehler or me? You can leave
A voicemail?
Yes, a voicemail on our podcast website. What is it, Dr. Koehler?
Our podcast website?
alabamathebeautifulpodcast.com.
Oh.
We'd love to hear from you. Thanks, Dr. Koehler.
Thanks, Kirstin.
Get back to making Alabama beautiful.
Got a question for Dr. Koehler? Leave us a voicemail at alabamathebeautifulpodcast.com. Dr. James Koehler is a cosmetic surgeon practicing in Fairhope, Alabama. To learn more about Dr. Koehler and Eastern+Shore Cosmetic Surgery, go to Eastern+ShoreCosmeticSurgery.com. The commentary in this podcast represents opinion and does not present medical advice, but general information that does not necessarily relate to the specific conditions of any individual patient. If you enjoyed this episode, please share it and subscribe to Alabama the Beautiful on YouTube, Apple Podcasts, Spotify, or wherever you like to listen to podcasts. Follow us on Instagram at Eastern+Shore Cosmetic Surgery. Alabama the Beautiful is a production of The Axis, THEAXIS.io.